Uh, Good evening, students. In endocrine system, in physiology, we completed pituitary gland, the hormones secreted by pituitary gland, and applied aspects, diseases regarding pituitary gland. Now, we are also completed thyroid gland. Thyroid gland, functions and regulation of thyroid gland. Coming to applied aspects regarding thyroid gland, hyperthyroidism. Hyperthyroidism is called as what? Hypersecretion of thyroid gland. Okay, under that, first disease is Graves' disease. Graves' disease, it is one of the autoimmune disease. So autoimmune disease means in the disease, body's own antibodies will kill the thyroid gland, will destroy the receptors of thyroid gland. That's why, because of the destruction of thyroid receptors, hypersecretion of thyroid hormones will be seen. See, normally thyroid stimulating hormone combines with the surface receptors of thyroid cells, causes the synthesis of thyroid hormones. Means whenever TSH hormone combines with the receptors of thyroid cells, leads to the secretion of T3 and T4 hormone. So, because in Graves' disease, B lymphocytes produce autoimmune antibodies called as thyroid stimulating antibodies. These antibodies acts like TSH by binding with the membrane receptors of TSH and activating the cyclic AMP system of the thyroid follicular cells. So in Graves' disease, what happens means B lymphocytes produces a special type of antibodies that is called as what? Thyroid stimulating autoantibodies. They acts like TSH hormone, will bind to the thyroid cells, leading to the secretion of thyroid hormones more. Okay, that type of disease we are calling it as Graves' disease. And also edema. Edema means what? Accumulation of fluid inside the thyroid gland. See, sometimes a localized tumor develops adenoma, not edema. Adenoma means tumor develops in the thyroid follicle. That is called as what? Thyroid adenoma, which is also known as thyroid adenoma, and it secretes large quantities of thyroid hormones. So what are the signs and symptoms of this Graves' disease? Means intolerance to heat. They can't bear even little much heat is there. So increased body sweating, decreased body weight, their weight should be low under. The people seems to be lean. Diarrhea, muscle weakness, neuronal disturbances such as nervousness, extreme fatigue, inability to sleep, mild tremor in hands, psychoneurotic symptoms such as hyperexcitability, extreme anxiety and extreme worry is seen in hyperthyroidism patients. And also toxic goiter is seen. Oligomenorrhea or amenorrhea means disturbances in menstrual cycles. Exophthalmos goiter. Exophthalmos means their eyeballs protrude to be outside. Okay, that is called as what? Exophthalmos. I will show the picture if available. Okay, in this textbook not given. Anyhow, I will show you the feature of exophthalmos. Wait once. See here in the picture, what you are seeing is exophthalmos. Wait. So protrusion of eyeballs out of the lids. Normally they will see like this only, but normal vision is like that. That is the one feature of exophthalmos goiter. Exophthalmos. Okay, next, polycythemia. Polycythemia means increase in RBC count. Heart rate will be increased, tachycardia. Systolic hypertension, increased BP, and cardiac failure is also seen. Okay, so these are the signs and symptoms of hyperthyroidism. Okay, next you don't know. Next, then, what is hypothyroidism? Means lower secretions of thyroid hormones from the thyroid gland. That first disease is myxedema. What is myxedema? Means decreased thyroid secretions in adults is called as what? Myxedema. They generally, while for looking, they are edematous. నీరులు ఉబ్బోళ్ళు అంటారు కదా, ఇడిమాటస్. దే విల్ బి బల్జ్ లైక్ obese. They will appears to be obese people. So what is the cause? Is myxedema occurs due to the diseases of thyroid gland, may be genetic disorder or iodine deficiency in the diet. So in addition to these causes, there might be the deficiency of thyroid stimulating hormone TSH or thyrotropic releasing hormone that is released from the hypothalamus. So what will be the signs and symptoms of this myxedema? Means swelling of the face, bulginess under eyes, means bags under eyes, non-pitting type of edema. When pressed, it does not make pit and the edema is hard. So that type of edema is called as what? Non-pitting edema. Atherosclerosis means hardening of the arteries. Next, anemia, fatigue, extreme somnolence. So the people will feel sleepy. Menorrhea or polymenorrhea means polymenorrhea means onset of menstrual cycles repeatedly in 1 month, for 1 month 2 times, like that. Next, decreased cardiovascular functions, that is reduction in rate and force of contraction of heartbeat, cardiac output and blood volume, increase in high body weight, constipation, mental sluggishness, depressed hair growth, scaliness of the skin, means skin becomes dry, frog like husky voice, cold intolerance. These are all the signs and symptoms of hypothyroidism in adults. Next, what is cretinism? Cretinism is decreased thyroid secretions in children. So what are the features? Means a newborn baby with thyroid deficiency may appear normal at the time of birth because thyroxine might have been supplied from mother. Okay, but the baby grows further. Baby development stages will be lagged anamata. The baby starts developing signs like sluggish movements, croaking sound while crying. Unless treated immediately, the baby will be mentally retarded permanently. Okay, so mental retardment is seen if the baby is not treated in time. Next, skeletal growth is more affected than the soft tissues, so that's why there is stunted growth with bloated body. Tongue becomes so big, hands down with dripping of saliva. A big tongue obstructs swallowing and breathing. Tongue produces characteristic features of guttural breathing that may sometimes shock the baby. These are all some types of signs that observed in the baby. Okay, those are the features of criticism. Next, goiter. Goiter means enlargement of thyroid gland, which is of toxic and non-toxic. So what is toxic goiter, which is seen in hyperthyroidism patients? There, goiter is seen because of the enlargement of thyroid gland with increased secretions of T3 and T4 because of the tumor. Non-toxic goiter is seen in hypothyroidism patients. There also enlargement of thyroid gland is seen. Okay, so because of decreased thyroid secretions, so which is of further types: endemic colloid goiter, idiopathic non-toxic goiter. Just names we want. So this thyroid function tests already you learned in biochemistry. So this is about the applied physiology regarding thyroid gland. Okay.